Who makes healthcare choices when a patient has no directives? Imagine you're in a hospital, unable to speak for yourself, and there are no instructions about what treatments you want. Who then decides what happens next? This is a common question in medical ethics and patient care. When a patient cannot make decisions and hasn't left any advance directives, someone else must step in to make choices. Usually, a surrogate decision-maker is appointed. This person is often a family member or close friend who knows the patient's values and wishes. Their role is to act in line with what the patient would have wanted, respecting their autonomy even if the patient cannot speak for themselves. If there is no surrogate available or willing to take on this role, healthcare providers step in. They make decisions based on what is medically appropriate to meet the patient's immediate needs. These decisions focus on beneficence, which means acting in the best interest of the patient. To ensure fairness and ethical standards, hospitals often involve ethics committees. These groups review complex cases and help guide decisions, making sure they align with ethical principles and respect the patient's dignity. Sometimes, if no surrogate exists and the patient is incapacitated for a long time, courts may appoint a guardian. This person then makes healthcare choices for the patient. However, guardianship is usually a last resort because it can be slow, costly, and guardians may lack specific knowledge about the patient's wishes. Advance directives are legal documents that allow patients to specify their healthcare preferences ahead of time. They can name a surrogate or outline specific treatments they want or refuse. Without these directives, decision-making depends heavily on surrogates, healthcare providers, and ethics committees. Their goal is to protect the patient's rights and ensure they receive care aligned with their values. In summary, when a patient has no directives, the decision-making hierarchy starts with a surrogate chosen by the patient or their family. If no surrogate is available, healthcare providers decide based on medical needs. Ethics committees provide guidance for complex cases, and courts can appoint guardians if necessary. This process upholds key medical ethics principles like respect for patient autonomy, beneficence, non-maleficence, and justice, all aimed at safeguarding the patient's dignity and rights even when they cannot speak for themselves.